investment in them so that the people in our community, young and old, can get a better paying job, so that we can attract right faculty to do research here, which is why I secured funds for Purdue University Calumet for their Center of Innovation that has already been used by a company like ArcelorMittal as far as trying to improve their various steelmaking processes so they can become more efficient and more profitable. I don't apologize for helping Indiana University Medical School at IUN so that we could buy equipment so that the medical students and faculty there could do biomedical research. I am proud of helping Mayor Hoskins in Valparaiso as far as his InTech Center to attract entrepreneurs who are interested in the biomedical sciences to Northwest Indiana. What is going to happen?
Is not great. That's too many years.
What is going to happen to those of us with health care through employers when our health benefits get dropped if the current legislation gets passed? I do not anticipate that that is going to happen.
That's my question. My employer has already said that if this health care legislation passes, he will kill our health care benefits and it'll be on our own. That doesn't mean that we're going to get the money that pays out into our paycheck, and it doesn't mean that we're going to be able to have the things that we have now. So what's going to happen to people like me, and there's going to be a lot of them, because people will figure out that $715 tax is a lot cheaper than paying for health care. Tell me what happens then.
My anticipation is
we didn't read the bill.
People see the legislation in its final form.
Nobody's seen it.
And understand that we are
Has anybody said anything to make you rethink your thoughts?
Many of these so-called threats
Or are we just all a bunch of dummies?
You don't know what's in it because nobody's been able to read it.
Ensure that small businesses of 15 or more workers will be allowed faith-based medical health care, such as Samaritan Ministries of Illinois. I don't think health care should either mandate or restrict the type of coverage that you want in your health insurance program. The point of the exercise is to make sure that people have options. President Obama promised transparency in government and to televise health care negotiations on C-SPAN. Why is the leadership in Congress ignoring his campaign promise? I think the decision by the leadership as far as the conference was a mistake. It was not a decision I would make. Despite the fact that only one Republican in either house voted for it, I certainly don't think in a legislative body
they were smarter.
Have been excluded. But I am not the Speaker of the House.
We got to buy some more votes.
Answer the question.
He's not answering it.
If the health care before Congress is going to save the federal government money, why does Indiana say that it will cost them money? The health care proposal, as certified by the Congressional Budget Office, is paid for. I don't think anybody in Washington is suggesting that this is going to be a money maker. What the state of Indiana in particular is concerned about is part of making sure everyone has health insurance coverage is the expansion of the Medicaid program that in part is financed not just by the federal government but by the states. Under the proposal that was passed in the House, the federal government for the first 2 years, and I would acknowledge it's only for 2 years, will pick up any additional costs. Thereafter, it would be a responsibility of states, whether it be Indiana or elsewhere, to assume the cost of those benefits. So that's my sense as to why the governor has indicated as a state he's not terribly enamored with the program. Why in the health care bill do we not have congressional participation? And I have addressed that. Why we don't have a cross-state competition, and that's not entirely correct. In the House version, as far as being able to buy insurance across state lines, there is a provision to have that happen, but to preserve the prerogatives of the states. And healthcare has tended traditionally to be regulated at the state level, is they would have to enter into compacts with each other to allow that to occur. For example, if the state of Indiana and Michigan entered into a compact, you could buy health insurance across state lines, Indiana and Illinois. Pick any other combinations, and hopefully it would be a national characteristic. The other question here is, why was there no tort reform included? I would acknowledge that is one of the failures of the legislation in both the House and Senate.
Vote against it.
When I spoke to forums last year, when I spoke throughout the year, I've indicated that there ought to be a reasonable compromise that can be struck. It's like with any other aspect of this problem. I'm not suggesting if you just fix that, you fix all the problems, but it would help.
50%.
As I referenced at my earlier forum, when I started my career out, it was with attorney Adam Benjamin Jr., who later went to Congress. But the important part of the story is Adam also served in the Indiana General Assembly. In 1974, he authored the first state medical malpractice bill that has been amended, but essentially we're still living under in the state of Indiana in 1974. And in my mind, if Adam could do it and the state of Indiana could do it, more effort should have been put into that in the federal legislation, and I would absolutely agree with the person.
Did you do it?
How do you justify a... You gotta write bigger. How do you justify a stimulus bill that provides for pet projects, maintenance of habitat, for example? To me, this is a waste of taxpayers' money and does not stimulate the economy. These projects have cost taxpayers billions of dollars. I think in the stimulus package, we could all find projects that, gee, probably should not have been in there. I wouldn't deny that. But I would also suggest, for example, when I talked about those infrastructure programs, those are of terrific value to communities like Northwest Indiana. And again, our regional planning agency last month let out for bids 40 construction projects on infrastructure programs in this country. And again, Schererville is participating in that bill as far as water treatment.
Congressman, that's my question. You didn't read the entire thing. There's projects like a swimming pool, a frisbee golf course in Texas, maintaining the habitat of a rat in San Francisco. These should not be in the stimulus bill, and it's billions and billions of dollars that are taxpayer money. But it's
I wouldn't argue the point that
Then vote against it.
because
He didn't read it.
that stimulus package provided
do whatever Obama wants.
everyone in this
Pelosi puppet.
tax cut last year.
No, it's
No.
They don't have
It
my
will
correct
rely for that $111 billion.
Would you need a tax cut if you didn't spend all that?
Why are you insisting we trust an untrustworthy government